Effective Basic Services eBASE Africa is a charity that is active in improving livelihoods of the underserved population, including children, women, people living with disability, and indigenous population, using innovation and best practices. In the Wakka project, we sought to improve the livelihoods of people living with disability using innovation and best practices. While working with people with disability, we realized that current practices and policies were not evidence-based, and most interventions directed towards them were not effective. For example, in Cameroon, the policy provides free basic services for people with disability, but these services are still not available for people with disability if they do not have a disability card. Prior to our intervention, most children with disability had unmet needs, and their rights to education, social well-being, livelihood, and empowerment were not being respected. This means the children with disability were economically vulnerable, and they suffered from a lot of stigma and community abandonment. We directly impacted on 30 families of children living with disability with an income-generating seed fund to start an income-generating activity. We influenced policy to ask for free access of basic services for over 100,000 kids who have a disability. We trained 5 community health workers to integrate disability in their daily household visit. We engaged stakeholders in stakeholder engagement sessions and qualitative studies, and we use their experiences and feedback to develop an evidence toolkit which is centered around families and communities of people living with disability. This toolkit is used by community health workers during household visits to score or assess families for compliance in using best available research evidence with their children with disability. Community health workers visit after every 2 months to assess families on their compliance with best practices, and families that score up to 60% compliance are rewarded a seed fund to start off income generating activity. Our toolkit is an innovative portal that synthesizes and transfers complex research evidence into households and communities. Household practices are audited by community health workers, and they provide recommendations based on best available research evidence. We use Max QDA, a qualitative data software, to collect and analyze qualitative data from sessions. We also use MapBy, a quantitative data software, to collect and geotag data of children with disability to facilitate decision making for policymakers. We use rigorous scientific approaches to incorporate qualitative and quantitative research evidence in the design of the intervention. We engage stakeholders in the design, implementation, and reporting. We also incorporated the intervention into existing frameworks like Community Health Workers program in Cameroon. The toolkit itself is an innovation. To the best of our knowledge, no one has ever implemented this kind of intervention in this community before, or building this kind of toolkit that gets research into households and communities. The challenges we faced include 1. Workload and timing. We had underestimated the workload and time for this project. It was supposed to run for 18 months and it has taken up to 2 years. 2. Funding. We had very little funding for this project. 3. The conflict in the Northwest and Southwest region that causes insecurity. COVID-19 has also impacted negatively on us. It has also been a challenge with work, and internet connectivity is very poor in Bamenda. Piloting an intervention or a proof of concept can be very time consuming and expensive. Therefore, time and funding must be considered and well planned. Technologies required for accurate geotagging are very expensive. Lower level phones may be very problematic when used with research softwares. We are only as strong as our weakest link. This means if one person fails, the whole team fails. It is exciting working with people with disability. The reward is more pronounced and fulfilling despite the challenges. 30 families are able to benefit an income generating seed fund for income generating activity to support the needs of their children with disability. 30 households are committed to engaging their children with disability in evidence-based practices to improve their rights. Policymakers have relaxed procedures for acquiring a disability card for children with disability. We have integrated the toolkit into the health system such that community health workers get to explore disability during their normal household visits. These benefits came from our intervention because, to the best of our knowledge, no one has implemented this kind of intervention in this community before. We conducted stakeholder sessions with families of children with disability. We had advocacy sessions with policymakers. We integrated the toolkit into the health system through community health workers. We incentivized the process by rewarding families with an income generating seed fund for engaging with their children with disability in evidence-based recommendations to improve their rights. We intend to further develop the toolkit to get more funding and to extend the work to Niger, Chad, and Nigeria. My name is Nayu Mirabel, and I am the coordinator for the disability project at eBASE. Thank you.